Hi, Dr. Desmond here. After gallbladder surgery, a patient recently asked me, what does he have to look out for? Number one, immediately after the surgery on the same day, there'll be pain in the wound. He'll feel bloated, he'll have no appetite, he'll feel drowsy because of anesthesia. So just live through the day one. Day two, they often have pain in the wound, which they can be quite severe. The pain can sometimes radiate to the right shoulder, and that's because the gallbladder fossa and the shoulder are supplied by the same nerve to the spine. Our brain may perceive pain around the gallbladder area from the operation to be at the shoulder. So don't get too alarmed when they have pain at the shoulder after a gallbladder surgery. They'll start to eat and drink and to walk. They normally fart and pass motion on the first or second day after the surgery. I typically keep the patient on the second postoperative day. Some patients can be discharged on the first postoperative day if they're young, fit, and they manage to pass motion to eat on day one. After that, they are discharged. We ask them to come back about a week to 2 weeks later, check on the wound, and usually by the end of the first week, they are fine and they don't need much painkiller. They can work. They can walk and work. But I always tell them, do not carry heavy stuff, do not exercise aggressively, because the wound, even though they have their small scar, the wound still need time to heal. It will take several weeks for the wound to heal completely. During this period, they shouldn't contract abdominal wall, such as doing sit-up, doing push-up, carrying heavy things. Usually, after about 2 months, the wound is completely healed. They want to run, they want to do exercise, go ahead, no issue. Gallbladder function as a bag of a capacitor, a reservoir of bowel juice. After eating, especially oily food, the gallbladder contracts, squeeze the juice out to digest the extra fat that we eat. A patient that has no gallbladder, I always jokingly say that if you go for a roast duck buffet, my gallbladder contracts to squeeze the juice out to digest the extra fat. Someone that a gallbladder surgery have no extra bowel juice, they will not be able to digest extra fat. So we ask patients after gallbladder surgery to eat small and frequent meal. In particular, take less oily food. If they take a lot of oily food, they're going to have a lot of fat. They're not well digested in the intestine. They're going to feel bloated and have loose motion and pain. Most of my patients will adjust accordingly. They listen to the abdomen and they will eat less oily food. Eventually, they can find a balance. Our liver will also improve, adjust by secreting more and more bowel juice so that we can digest the fat. Usually, after a while, everything is okay. The scar for the gallbladder surgery are normally very small. I jokingly say that for men, they can still join men hunt. For a lady, they can wear swimsuit. Only the spouse that look really clear to very, very close to the belly button can see the scar. So most of my patients after gallbladder surgery live a normal life. Overall, gallbladder surgery is not a major surgery. It's we call an intermediate surgery. They stay for 2 days after surgery. Most of them, they mean a complete recovery. Just have to avoid carrying heavy things, carry string exercise about 2 months after the surgery, and avoid eating a lot of oily food for the rest of their life.